Hi, everyone. Welcome again to the EAF Festival 2023. I'm Dr. Ebele Mogo, and I'm part of the EAF team. And I'm joined today by Dr. Esther Nayeu. Did I say it right?
Yeah.
Okay, so today's plenary conversation is about effective strategies for health in Africa. And there's no better person to have this conversation with us. And I'm going to give you the rundown of Dr. Esther's expertise, and you'll see why. So Dr. Esther has a Doctor of Medicine. She has also a master's degree in public health, I understand. She's worked as a public health specialist at the WHO, World Health Organization, focused on addressing chronic diseases, improving health in Africa, with a specific focus on developing and implementing multi-sectoral approaches and policies. She's also completed the Mandela Washington Fellowship for Young African Leaders. She's also worked as a UN Volunteer Technical Officer. She's also served as an African Woman Health Champion in Congo-Brazzaville. And there's probably much more that I haven't even covered. So thank you very much, Dr. Esther, and welcome.
Thank you very much, Ebele. It's my pleasure to be here. I hope you can get me clearly. Like you rightly said, I have some experience in Africa in promoting health and reducing non-communicable diseases. I'm Dr. Esther Nayeu. I've worked as a medical doctor in the hospital where I've had a first-hand experience seeing people suffering from non-communicable diseases and managing these diseases. And after which I decided to no longer be on the receiving end, but to be on the decision-making table to shape policies that would even prevent people from getting into the state where they will be rushed into the hospital in emergencies. So I have experience supporting countries in Africa to put in place regulatory and fiscal policy measures to promote health and prevent non-communicable diseases. Thank you, Ebele, for having me.
Absolutely. I really like what you said about you didn't want to be on the receiving end anymore. That's a very apt way to put it. And I think this conversation is really like, how do we actually stop being on the receiving end? Like, what kind of things would work so that we can start proactively addressing health, preventing diseases, preventing non-communicable diseases, as well as creating health. Like, what kind of policies will actually create health as an asset? So today we're going to talk about a lot of those strategies that we've heard of. We've heard a lot about the WHO, for example, Global Action Plan on Physical Activity, Package of Essential Non-Communicable Disease Interventions, SPEM Plus, Sugar-Free Tax. There's a lot of sort of continental strategies. And we want to really go into them and really understand, okay, what does this involve? What does it take? How are they going? Where it works? How does it work? So maybe we can start by talking about actually, like, how did that shift happen for you? So you said, you saw people, what did you see? And then what did that shift look like? How did you start shaping that path towards more of the proactive work on creating health on the continent?
So just imagine yourself working in the hospital and you see this very young, beautiful, energetic lady that is rushed in an emergency, suffering from, let's say, a hypertensive crisis. And after struggling Are you getting me? Sorry, are you getting me?
Yes, you froze a little bit, but you're back.
Okay. Sorry for the network. So I was saying, just imagine yourself in the hospital and you receive this young lady that is rushed in, very beautiful, energetic, and she is rushed into the hospital due to a hypertensive crisis. And after struggling to manage her condition, she ends up losing her life. You could have imagined what she would have become tomorrow, or maybe the children she has left behind, what will become of them. Those are some situations, some circumstances that really made me to feel like I was tired of being at the receiving end, losing young people who would have been our leaders of tomorrow, who would have been the agents of change, who would be our fathers and our mothers of tomorrow, losing them at a very young and tender age, at a productive age to these non-communicable diseases. And I knew that there was something we can do at the level of the government, at the level of prevention, that will help these people not to get to this level. Because when they already get into that critical stage, then it becomes very difficult to manage. And sometimes some of them will just stay for drugs for the rest of their lives. And it's very, very difficult, stressing situation, both for them, their loved ones, and their family members. But I knew that this disease is a disease that can actually be prevented if we put in place the right measures, the right policies that would help people, provide an enabling environment where people will make healthy choices, where people will feel free and safe to be physically active in order to stay away from complications due to non-communicable diseases. That is where I started to learn my expertise, learn my knowledge to governments, to organizations, to countries, to help them to put in place these frameworks, these interventions, these policies that will help people to prevent non-communicable diseases. So that is why I actually had to take that major step in my career. And I have ever since enjoyed it. And I am happy that I've been able to contribute and support some countries to put in place measures that have helped people to be physically active, to consume healthy diets.
Mhm. That is very inspiring, actually. It's very, very inspiring. When you say it, I think sometimes we talk about in terms of the numbers, but just really hearing the story, I think a lot of people can connect to that in our lives. We know those people that we lost, or we know the stories, we know the stories behind the statistics as well. So thank you for sharing that. I'd love to know more about, so you talked about putting policies and strategies in place. How is that going? What kind of policies have you seen? What is the process behind creating some of those effective policies and strategies that can help to address non-communicable diseases more proactively and stop us from being on the receiving end? I really like that term. So what does it take? I think it is very interesting to people listening to get that picture as well. Yeah.
Yeah. So when policy advocates hear of policy formulation or policy design, first thing we know it's a lengthy and complicated and tough process. You need to push, you need to fight. It takes a lot of time, it takes a lot of human and financial resources, it takes a lot of persistence, commitment, passion in order to engage in such a project, because definitely you will meet several barriers on the way, administrative bottlenecks, and people who are out there, to make their own gain, their own profit out of the whole issue. So it's a very tough and, financially demanding project. And that's why we don't have so many countries in Africa actually developing policies in order to prevent non-communicable diseases. The few that even have these policies, they are poorly implemented. The compliance is very poor. So that's also another thing. We have been able to support countries to adopt sugar sweetened beverages, taxation policies in that area. We have also been able to support some countries, to adopt policies on marketing restrictions of sugar sweetened beverages or healthy diets to younger children, as well as policy on physical education in schools. So some countries, they are actually making an effort. They are very conscious. What is good is that they are quite conscious of the benefits of such policies and the importance to have those policies in place. But given the fact that it's quite a lengthy process, it's quite a complicated process, we have very few countries who are engaging in that project. And the others who even have these policies, they are well documented, well written, but sometimes the implementation can be very poor. So we are still behind in Africa in terms of policies. We are struggling, but we are not yet there. We are not yet there. There's still a lot that has to be done, and the governments really have to put all on deck in order to ensure that we have those policies in place to prevent non-communicable diseases.
Got it. Thank you very much. There are many things you said that I think we need to explore, in more detail. Everything you say is very rich. So I'm like, where do we go now? I think the first thing I want to explore is, sometimes we don't even know that there are some countries where there's some bit of progress, happening. And I would love to know, like, where are those countries where you're seeing progress, and what is unique about those countries? What was able to make them to have that momentum to create those policies around, say, you talked about physical education, you talked about did you say I think sugar-free tax?
Sugar sweetened beverages. Yes, so
What was context that enabled that to even happen?
we have some few countries in Africa, like South Africa, like Nigeria, like Mauritius. They are actually trying, making some efforts in that area. I could say maybe it's due to maybe the financial capacity of the country. It could also be due to available human capacity, human resources, because the challenge in our African region is that we really lack, the financial capacity to do that. And also they have had people who have been able to push the agenda forward. That's what I really tie that to, the human and financial resources. So countries that have those two, they actually try to move forward, especially if they have their database is well developed, they have data to back that evidence and to be able to make informed decisions. So human and financial capacity has actually helped some countries to make advancements in that area.
Got it. Because when you said Nigeria, South Africa, I also thought, I feel very proud because I'm Nigerian, but but I also thought that these are countries that tend to have like high GDP per capita comparatively when we look at the continent, right? So it's interesting that those are the ones where you're seeing some momentum. And I wondered if even in these countries, are you seeing like, because across governments, as things change, the political context change, do you see that this momentum is sustained? Like some of these policies continue to be implemented across governments and changes that happen?
Yeah, well, I think it is. It's gradual, it's slow, but it's there. I think if we continue to push at the level of NGOs, at the level of CSOs, at the level of philanthropic organizations, if we continue to push, we will actually help these countries, because they are willing, but sometimes they just need the financial resources and the technical support in order to implement this project. So if we continue, putting this at the forefront, because NCDs has attracted some sort of international attention the last 1 or 2 years. And so it's basically on every high level meeting, you would hear discussions on NCDs. So if we continue to push it, we continue to prioritize it, and we continue to support the countries, I think they will keep up with the momentum. I'm hopeful.
Yeah, and it has changed, because I think like even a decade ago, people didn't realize as much that NCDs are in Africa. I think that things are now changing, which is good, And what would you say, like, what I'm understanding is we're making a bit of progress, but we're not yet making enough progress, and that progress is quite uneven, right? What do you think to take? What kind of resources do we need so that, say, other lower income countries, other smaller economies, smaller populations across Africa would also have the resources that they need to be able to start addressing NCDs as well?
Yes, so like I already mentioned, the very first two, we have the financial and the human resources. Those are capital. But then we also need multi-sectoral collaboration. We need to come together. Like to address entities, we need a whole of a system approach, and we need to address it through a holistic lens. So it's not a one-man show. It's not an issue of the Ministry of Health alone. We need CSOs, we need NGOs, we need the private sectors, we need academia, we need philanthropic bodies. We need everybody to come and put hands together, join minds together, and to promote this, because it touches every level, it touches every aspect, it touches every area. So it's not a one man's business. We all have to work together at the level of the ministry, not just the Ministry of Health, the Ministry of Finance, Ministry of Trade, Ministry of Education, Ministry of Youth and Sports. We have to come together. We need that collaboration. And that is why if you look at all the frameworks that we have out there today, they emphasize on multi-sectoral collaboration. It is very important moving forward. You see, when COVID came, it actually opened our eyes to the fact that we are not where we're supposed to be. And because we have not been doing things the way we're supposed to do it. So we need to realize that alone, you can't go far. You need the help of your brothers, of your neighbors. So we need to join hands together to support, even if we are not receiving the support out there. If for example, let's say we are short of staff, but we have someone in the Ministry of Health that is ready to collaborate with someone in the Ministry of Finance, who is ready to collaborate with someone in the Ministry of Education, we can join hands together and build a strong team that can move the agenda forward. So we really need multi-sectoral collaboration at personal level, at government level, at all levels to tackle NCDs.
Thank you very much. And you talked about, for example, like trade as one of the multi-sector, one of the multi-sectoral collaborations that I need.
Yeah.
Exactly. And it's very interesting because I think that there's been a lot. Okay, so for example, the African Continental Free Trade Agreement, there's been a lot of push around that. There was a time when there was a lot of push around kind of like that Africa Rising conversation. And I often wonder, like, are you seeing health being integrated into this conversation? Are you seeing health being integrated when people are talking about trade? Because when I think of trade, I think of food security. I think of the connection to health. When talk about built environment, which is which shapes whether or not we can exercise safely and things like that. Even climate change, right? So like, are you saying that, do you think health is being integrated? In what cases, and how do you think maybe health can be better integrated into these conversations we're having in other sectors around the future of the continent?
Let me just give you just a simple example. Look at the countries that are being affected by food security, like you mentioned, food insecurity. Those countries are the Horn of Africa, like Ethiopia. If we have this free trade, agreements in Africa, which will permit, countries to open up for food, to come in, businesses to grow. How are we going to really, how can I put it? It's going to limit the amount of suffering that we find in these countries, because now you can have food from your neighbors. Someone can be able to bring in goods and come and sell, and it's going to reduce the amount of poverty and hunger, and that is going to indirectly reduce non-communicable diseases. Because if you look at the root cause of non-communicable diseases, the very, very root cause at its roots, we have problems of poverty, problems of hunger. When people do not have money, they are stressed out, and that leads to hypertension. And people are hungry, they don't eat well, that could lead to malnutrition. Those are non-communicable diseases. So if we can already, in this multi-sectoral collaboration, use some of these strategies to come together, open up, it's going to boost the economy, and there will be increase, there will be prosperity. When people thrive in prosperity, they will thrive in health. So those are some areas. When I talk about sectoral collaboration, we need ministries of health also to be involved in such agreements, because indirectly, even if we don't see the link directly, but indirectly, it is going to have an effect on health in the long term. Where there will be hunger, where there is no food, maybe the soil is not good, climate change has damaged the soil and people cannot grow food, they can get it from their neighbors. It can come in from other countries. Africa is very rich. There are countries that have enough food, they have good soil where they can grow enough food and they can share. But all the barriers that have been put across, just hinders this trade, and it makes it difficult for food to come in. And so some people will be suffering and dying from hunger in Africa, which is not supposed to be the case. So these strategies, these agreements have an indirect effect on health in the long term. You might not see it in the short term, but in the long term, because it's going to bring in food, it's going to tackle the problem of food insecurity, it's going to tackle the problem of poverty, it's going to bring in development where businesses are thriving, there will be development, there will be jobs, which will reduce the level of poverty. People will be able to afford health services which are expensive. people will be able to now afford them and have access to those basic, healthcare, where they can go and screen themselves from non-communicable diseases, and they detect it early, and they live better and healthier life. So it's an indirect path, because it's interlinked. We can't isolate it. And that's why I say we need to start collaborating on every project. We need to look at what are the benefits on health, what are the benefits on the economy, what are the benefits on education. Will this agreement, improve the economy, where we will have more roads and people will have access to healthcare, access to schools? Would there be development? Would there be more building, more infrastructure for people to now become physically active? Those interlinkages, they are all there. They are all there. That's why we all have to come on board when we have this kind of broad, strategies. We have to look at the benefits for each sector, and then we work together to see that we implement it, so that it can be a win-win on every side. So I don't think there is a project that is completely limited to one particular area. No, in the long run, it has its benefits on other areas. So it's very important for that partnership.
Yes, absolutely. And when you said I was just thinking, when you talk about why health coming to the table, making it a win-win, making it so that, like you said, how does it cut across our workforce development, our economy, and all of that? Sometimes it seems as if, this other health harming commodities come to the table faster, right? Because sometimes you see economies that say are growing tobacco, and they're really relying on tobacco for their economy, or sugary drinks, and they have a lot of powerful interests, right? And I was wondering, like how can health be ahead of these things, right? Because a lot of the long-term decisions that we're making in growing our economies actually have a big impact on our health, right? So how can health be ahead of these things, so that it's not sort of the health harming interests that are shaping where the economy is going? You see what I mean?
Yeah. Yeah. I think we have to start prioritizing health, because if someone is not in good health, I don't think there's anything you can be able to achieve in this world if you are not in good health. So we should always look at it, everything as, is this good for our health, before we look at the other benefits. Definitely, there are other benefits when we import those sugar sweetened beverages. It also brings in money. That's the truth. It also brings in money when it is sold. Private businesses, they grow. They flourish. Actually reason that, how does this impact health, or does this improve people's health? If we always put health in everything, we will see that these commodities, they are harmful to health. And so we need to price that, we need to tax them, we need to put taxes that will limit the importation so that they become expensive. But in Africa, it's not the case, because we are not yet there. You will instead find these sugar sweetened beverages being the beverages that are more affordable and available at every store. You will find them everywhere, and they are cheap. So why would somebody who has limited income, take much of his money to go and be buying maybe something that is alcohol free or sugar free, which is expensive, when he can just buy something for 100, 200? Why would he do that? He doesn't have the funds.
Exactly.
And maybe he's not even aware of the negative effects of such on his health. Maybe he is aware. Sometimes they are aware, but that's just the money they have. That's their financial condition. So they have to go to what is affordable. If not, they will not be able to pay their rents. They will not be able to send children to school. If they want to concentrate on buying, oil that's free from cholesterol, only vegetable oil, how much that costs in our communities. So, but that is where the government has to step in, subsidize some of these healthy foods and tax the unhealthy ones, so that they become less available, they become more expensive, and even use some of the money from that tax to invest in health, to invest in some health promoting projects. And that will help us. So we just need, the government to always put health first in everything, because the healthier the people, the stronger the workforce, and the stronger the economy is. If people are sick, people wouldn't be able to work. Okay, and the economy, there's going to be a downturn on the economy. So our government have to start thinking about, how does this affect health and ensure that health comes first in every decision they make.
Yes. And even when you were talking about this sweet thing, sometimes I even marketed as healthy, because sometimes people get all sorts of confusing information. They don't know, they might think this is healthy,
Yeah,
So there's a
that's
lot
true.
of work to be done.
Yeah.
And so when it comes to these frameworks that aim to address some of these things, right? They're quite a lot, like I previously said. Do you find, what does it really take for an organization? So you have sort of the GAPA and the WHO, you have this Africa CDC, new and public, I think it's called the Public Health Order or the
Order.
new health.
Yes, new public health order.
And while these documents are inspiring, I always wonder, like, okay, what makes an organization the one to sort of set this? And when they're setting this, say, documents and orders, are other organizations involved so that we can actually make sure that these strategies are effective, right? Because we can have a lot of
Yes.
strategies, but what makes everybody come together behind, say, an organization strategy to say, okay, we're behind this and we're going to implement this, right?
Oh, so usually, when an organization decides to come up with a strategy, usually it's because of sometimes basically two things: a request from the countries.
Okay.
They have requested that, okay, we know that this is important for us, but we don't know how to go about this. Can you guide us? Can you give us a framework or a guiding document which we can use, to implement this project for better health? Usually, we have that request coming from countries. That is what's going to stir, organizations to now come with guiding frameworks that can help countries, to tweak it in a context specific manner so that they can implement it and achieve their aim. And secondly, sometimes decisions taken like that are usually based or backed by evidence. If you look at data or look at research and you see that, okay, we have a rising burden of NCDs, what can we do? From there, we can decide, okay, to come up with a framework or a strategy or a plan that can help countries, to curb the rising prevalence of NCDs. So it's either it is evidence-based, backed by data, or a request from countries where they need this. And so when you'll be producing it, you know that it's going to be useful because you are going to share it with them. It's something they have requested for and that they are going to use to implement in order to improve health. So generally, that's how we come about those frameworks. And when they are being developed, of course, it's not just one organization, because like I said, this partnership, multilateral partnership is very, very important. So organizations work together, they come together, when the document is being developed, they share with other organizations to review and provide their comments, provide their input, what are the other things they would like to see in the document, how would they like it to be fine-tuned, so that the document is going to be useful not only to the organization, but to other organizations out there. And when other organizations will realize that there's the existence of such document, it will also prevent them from duplicating the document or from, developing something similar. They would rather develop something that has an added advantage to what is already there, or something that is similar, but is more focused, you see, but different from what already exists. So there's the need for that partnership so that we don't duplicate, okay? And then we also have other people's opinion so that when the document is now available, it can benefit not only the organization, but other organizations that are working in that area.
Got it. Okay.
Yeah.
And you've said a lot about the role of so when it comes to these partnerships, we've said a lot about the importance of things like finance and data, right? So when it comes to finance, do you think, what have you seen work in terms of mobilizing financial resources to addressing entities on the continent? What kind of skills do people in the health space need to be able to do that better in order to kind of fill the gaps that we've discussed?
So you should be able to advocate, you should be able to, write grants, you should be able to lobby for funds. Those are the kind of skills that you need. You'll be able to identify who are the particular stakeholders that will be interested in this particular piece of work you need to do. You have to do your research, okay? Because we have organizations that are interested maybe in a particular area of entities. Maybe some organizations may be interested in the health, in the diet aspect, others will be interested in the physical activity aspect. So you need to do your research to find out which organization is interested in the particular work you're doing, and then be able to pitch your idea to them that this is what I want to do, and this is the benefit it's going to have, this is the outcome, and clearly communicate your outcome with them in order for them to support you in providing some of the funds. And also you could share your ideas with other organizations also that work in the same area, who can provide the technical support, because not just the financial support. Sometimes you also need technical support. Say, for example, if you're working on something on diet, you might need the technical support also coming from WFP or FAO. So those are the kind of supports you need that can actually help to implement some of these projects.
Okay. And when in terms of the technical support, maybe we can speak a bit about the role of data. You talked about sort of, yes, the technical data, talking about what the outcomes would be and things like that. What role do you see data playing in terms of shaping advocacy for addressing NCDs, and then shaping continued funding, shaping partnerships, policy implementation, evaluation, all of that?
Definitely, it plays a very big role. Say, for example, you are a philanthropic organization who is interested in the area of working in the area of NCDs. And then I come and tell you, okay, there's this work I want to do. It's going to help the people to improve lives, to save lives, maybe the countries are interested. And another person comes and tells you, you know what, in this country, 54% adults are suffering from NCDs. Yeah, 54%. What is the data around it? Why are you doing it? Those are the kind of things that will motivate someone to be able to put in money, because sometimes the money is a lot. So you need to we need those statistics, we need the figures, and sometimes these figures will actually help us in the monitoring and evaluation. Okay, you have had this fund, you have implemented this. What is the difference from the beginning, from the time you started to after implementation? What is the impact of your project? So it's always important to have statistics, it's always important to have data, so that it will help you to know if you are actually impact in the community, if you are actually changing something. People won't listen to you if you just come and tell them, oh, you're passionate about this thing and you want to do this. You have to have your facts straight. You need to have your data. It's important.
And do you think that what kind of databases are there, for example, in terms of tracking NCDs in Africa? Do you think that we have sufficient databases? What direction do you think that data generation is going on when it comes to NCDs?
So for NCDs, we don't really have like the amount of data that we wanted to have for NCDs. Well, WHO is trying and has some databases, but what I know is that countries have a survey they carry out every year, known as the STEP survey. So it gives like an idea, of how entities are being monitored at country level, but then it's not very elaborate on diet. So we have WHO databases for NCDs that actually tell us what are the measures the countries have put in place. We also have the WHO Global Intervention for Nutrition Action that provides us information with the number of countries that have policies for diets, especially trans fat and salt, and also provides us information with countries who have applied a tax on sugar sweetened beverages. There's some data, but at regional level, but at country level, really the situation is not good. So many countries, we don't have that data. That's one thing we are pushing for in order to promote that particular aspect of data, because we want most decisions to be evidence-based.
Got it. Thank you so much, Dr. Esther. You
You're
clearly
welcome.
have a wealth of experience, and I feel like there's so much we can talk about, but let's see this as the beginning of an ongoing conversation. Um, I wanted to say, in all this your extensive work, now for you personally, Dr. Esther, what inspires you? Because we've talked about how, there's a lot to do, there's a lifetime of work to do, and it's quite sobering when you think of the lost potential, in terms of people who we lose or we see being lost to NCDs. So what inspires you to keep going in this work?
Well, for me, it has always first been medicine from childhood because my parents suffered from non-communicable diseases. So I've always, had that idea of I have to look for a solution for them to help them. That's why I entered in medicine, and non-communicable disease is something I've also why people should be suffering, because tell you the financial burden and the emotional stress is not easy. It's something I've experienced firsthand in my family. I've even lost loved ones to non-communicable diseases. So it's a personal fight. It's a fight for us personally. And then I have also had that experience with loved ones, with people I have, managed in the hospital, and I've seen the way that suffering, to buy drugs every month and to maintain your drugs, go for screenings. It's a hard struggle here in Africa. It's really a hard struggle. And so that's what motivates me to keep doing the work, to ensure that other people, the younger generation coming up, they do not find themselves in this situation, because it's a very, very stressful situation. So whenever I think of my parents, I think of what people are going through out there. It keeps me motivated, because if I can help people out there to stay away from this disease, for me, that gives me joy, that gives me fulfillment, because I know the hurdles you go through when, and these diseases, one thing with them, that they are chronic diseases and they are silent killers. When you have them, it's always difficult to get rid of them. You just keep managing them, and you can have them in you without knowing, until when it reaches the terminal end. So it's something that I would give anything to fight it, because it has affected me personally.
Wow, touched. Because actually that was a similar journey for me, because I remember when I was growing up and you see all these people that you lose and you're just like, this is so sad, like in my own family as well, loved ones, and then friends, or sometimes someone can't go back to school because maybe they lost their parents, right? So you start to see like this is a big issue, and like you said, it's silent, it's chronic, right?
Yeah.
And it can devastate, like it can just devastate people's lives, their families, change everything. So it's very
Everything.
yeah, it's very inspiring to have someone like you. I think we need people like you in this space. And I think we just want to also thank you. I'm sure that because I'm having goosebumps here. So I'm sure that people who are also watching will also be feeling very inspired. And I think Africa is very lucky to have people like you that have, the intellect and the heart and the desire to make this change, So I think thank you so much for sharing your time with us, and thank you so much for what you do. And really the goal of this festival is really for us to highlight like people that are doing things and what they're learning, so that we can we can see what's happening, we can see what's working, we can see where there is to go, and hopefully maybe it's a platform for dialogue and collaboration as well. So I think we very much achieved our goal with this conversation with you. We'd love to know where can people find you? Is there anything you want to share with the audience? And where can people continue this conversation with you?
Yeah, so I run a LinkedIn page because, like I said, I think NCDs are something very personal. So I run a LinkedIn page where I share information about preventing non-communicable diseases, as well as opportunities for young people, because one aspect of my work, I really love working with young people. And trust you, NCDs at first, they were diseases for the old. but now it's becoming more prevalent among the younger population. So the young people have to be aware of these diseases in order to stay away. So I share information on my LinkedIn page at Esther Nayeu, where yes, you can find even opportunities on NCDs, because I believe young people need to be empowered. They need to be given the platform to share their voices, to contribute to decision making and activities, that affect their health, that affect their lives. So I share opportunities, I share information, I share the latest news on NCDs. So you can check me out there. I'm always sharing something.
Fantastic. We're going to link to that so that everybody can follow you and see your great work, and also see the opportunities and feel empowered and get the information that they need as well. So thank you so much, Dr. Esther. I think that we're gradually coming to the end of our time together, but like I said, it's a conversation that will continue. So thank you so much for your time, and yeah, we'll continue having this conversation with you.
Thank you so much for having me. Thank you. If there's just one word I want to say to everybody out there, before looking at the government, first of all, you have a duty to yourself to keep yourself healthy, make the right choices, eat the right food, exercise. Nobody can love you more than yourself. So do your own homework, do the research, know what's good for you, and as much as you can, go for it. We will keep pushing that our government will continue to help us to have that enabling environment where people who have made the right choice can actually exercise it, but then at individual level, take it personal and make your decision to live healthy.
Yes, and in our communities as well. Fantastic. So stay tuned for the rest of the festival. We'll be back with the next set of conversations. Bye-bye.